in so many ways, including mental health.
Today, a new poll was released that has a look at how people are coping as the second wave hits. 25% of respondents say their stress level is higher than during the first wave of COVID-19. 19% say their mental health is better now than in April and March, and 54% say their mental state is about the same as when the coronavirus first struck. The biggest source of anxiety was concerns about the length and severity of the pandemic. That was followed closely by social isolation and family health. The online survey was conducted by Leger and the Association for Canadian Studies. With more, we are joined by Dr. Sonu Gaind, Chief of Psychiatry at Humber River Hospital. Dr. Gaind, we're hearing the numbers, but is there one piece of advice you could perhaps give to anyone experiencing mental health issues due to COVID-19?
Well, you know, we're all social creatures, and whether you've struggled with mental health issues before or not, we're all struggling now with adjusting to COVID fatigue, with adjusting to the social isolation, and with adjusting just to the changes of what we've lost in our previous lives. And in many ways, people have conceptualized this as a framework where we're all grieving. If you are additionally struggling with mental health issues, you can imagine how much harder it is. We're seeing all sorts of healthcare disparities emerge, especially for our mental health populations. And in terms of coping, you know, the best strategies that we're advising right now are do reach out to make whatever connections you're able to and however you're able to safely. And when we do this, you know, our lives are all different. A lot of these connections are now virtual. And in that context, we can still gain a lot. But what we also need to not be doing constantly is reminding ourselves of how different everything is and what we've lost. That keeps us stuck in what we're not doing rather than what we are able to do now for our own benefits and health.
A lot of children, of course, will be disappointed by the news Halloween will be canceled for those in COVID-19 hotspots. Any advice to the kids out there?
You know, it's an interesting mix that when we feel disappointments like that, which is understandable, and again, think about your own life, all our lives. We are all not doing things with family and friends that we have for years. And that's a bit of a two-edged sword because we do miss that, we regret it, but it also shows the value of those very things that we're missing. So the advice would be find a different way of connecting and not thinking that just because we can't do our usual that we can't do anything. We can still do a lot to connect with friends and loved ones. And I think that's probably the best advice, to do what we are still able with those relationships we cherish.
My mother always told me that I should not compare myself to other people, but I'm wondering, how do we compare to our American counterparts?
Well, I would say that in sum total, I do believe we're doing better than our American counterparts. Having said that, you know, we know they're struggling with a lot of issues down there in terms of their rates of illness and the responses to illness, but we can still learn from some of the evidence coming out of there. There's a major new study that's going to be published in the next edition of the World Psychiatric Association Journal. This looks at 61 million health records in America. And what they find is that people with mental illness are not only at higher risk of having comorbid medical illness, they're at higher risk of getting coronavirus and COVID. If they get COVID, they're at higher risk of being hospitalized. And if they get COVID and are hospitalized, they're at higher risk even of dying from that. And so one of the lessons we take from this is that, you know, while coronavirus is an illness, it's a virus, it does not discriminate. Coronavirus does not discriminate between black, white, or brown, but it does show us where we do. And so one of the lessons that we can take from that is to ensure that whatever we're doing moving forward in dealing with this situation and changing our health system, that we don't simply re-entrench the health inequities that those with mental illness have traditionally faced.
Good advice. Dr. Sonu Gaind, the Chief of Psychiatry at Humber River Hospital, we thank you for joining us this afternoon, and I wish you good health.
Thank you for your interest.
Take care.
As people try to manage their stress and anxiety, experts say